Welcome to the Gum Guru podcast. Thank you so much for being here with us. I'm Jason Kong, here with Dr. Macon Singletary, and today we are addressing dental myths, and we're going to bust those myths and talk about the importance of second opinions as well. Dr. Singletary, thanks for being here as always. This would be a really hard show to do without you because it would be about 30 seconds long, I think.
I don't know about that, Jason. I think you could do pretty good. You've been listening to me for a while.
Well, at least I can help with some action steps because, I always take notes for those because you do such a good job. But let's get into some of these dental myths because, it feels like nowadays misinformation just can spread like wildfire, and there's, I'm sure, lots of things that your patients bring to you and you're like, I wish people didn't still think that because that's not right. Let's get to some of these myths.
Well, this can be sort of complicated in a sense, but one of the big things that I see in my practice and get second opinions or asked about is we've had dentistry has really come into its modern age after World War II in terms of equipment and dental materials. And one of the things that's been around a long time that's been vilified to a certain degree are amalgam restorations. Yes, they're made with mercury, but they're in a capsule. Dr. Eames, who is a researcher at Emory University in Atlanta, formulated a precise combination of the minerals, be it the amalgam and the other metals that are in there, in a capsule that's amalgamated, and so there's no aerosol. But once the amalgam's put in, it's very durable. Now, this day and age, because of mercury in general, they don't allow mercury in Europe. I think amalgams, you still can get them, but once they're in, they are very durable. And what happens, the resin restorations are beautiful, they're white, but they're not as durable. And so I get second opinions. They want to take out all my amalgams and put in resins. Unless there's decay or a fracture, leave them alone. They will last forever. I've got some in that were put in when I was 8 years old. That's why I'm a dental phobic. Family friend, but they're very durable and they'll last forever, and they don't need to come out. And so unless somebody's really concerned about cosmetics, which you want to be aware. I mean, just because it looks beautiful doesn't mean it's going to last a long time. You may have to spend more money down the road because that has to be taken out and put in again. So that's one particular one.
Yeah, that's interesting because, I'm sure you encounter many of these regularly. What are some other myths that are on your mind?
Well, recession, or you have these little clefts in the neck of your teeth, and they're called ab fractures. Ab fractures are the result of a history of clenching and grinding. There are three reasons for them: acid reflux, acid pH, or clenching trauma. Unless it's really sensitive or there's a propensity for decay and not an aesthetic issue, because when you smile, usually they're your posterior teeth because they're your grinders. You don't see them. But I also have people come in and say they want to put fillings in them. Unless they're not susceptible to decay, if it's really sensitive, I would recommend fluoride toothpaste and topical application of fluoride, or you can do hydroxylapatite, or there are toothpaste now that are non-fluoride, but they can use that will help remineralize the tooth structure. So doing that first rather than spending money, because if you put a resin on top of an ab fracture and your clencher or grinder, they're going to pop out. So that's one thing in particular that you need to be aware of.
I can imagine that it's hard in that regard because, especially with something like recession where, someone wants to address that, and if someone offers them a solution, you first instinct is probably to get excited that, hey, I can get this fixed. But, I know you're always a big proponent of getting a second opinion. How do we try and balance that?
Well, I mean, it's your gut. If you want, it doesn't hurt, and he wants to put a graft on a recession. Unless it's an aesthetic issue, grafting is not going to help sensitivity. But the main thing is if you get a recommendation and you look at it and going, wow, it doesn't hurt. I don't feel like this is a problem. And I understand that he sees something, get a second opinion. Another factor that we see this day and age, particularly with implants, is recommendation: take your teeth out and do all on fours. And really that's a misnomer because it's rare you can do a fixed bridge on implants on 4 implants. Usually it's 6, 5 or 6. It makes it more stable, and that can be an expensive endeavor. Just because you've got some fractured teeth or you do have periodontal disease doesn't mean those teeth need to come out. And that's another big ticket item that if you're looking at it and you're going, wow, this looks great. I like the idea of not having to take anything out. It's fixed. The question is, will those implants be with you, 20 years?
Yeah, the longevity of it, as opposed to keeping the teeth that you have and maybe having a balance there. It's again, I think it's a situation where you just have to really be careful because it's nice when a solution is presented to you and it maybe sounds good, but you really have to make sure that you're thinking through the positives and the negatives of the entire situation because it is your health. Let's get to some more myths here that we need to be aware of.
Well, I always say beauty's in the eye of the beholder. Some people come in and they'll say, and their second opinion about having orthodontic therapy. Orthodontic treatment is great. You want the forces of occlusion along the long axis of the teeth. But if people say, well, my tooth's rotated. To me, you can have your teeth straight as a picket fence. If you're not flossing and brushing, you're going to have problems. So, again, it's comfort and function. If you're feeling good about them and tooth doesn't hurt, and it's really not something that you went to the dentist as a primary reason, get a second opinion. But again, getting your teeth in position and making them look good and have them lined up right is great, but there's always down the road, are you going to get relapse? You have to be putting retainers. Is this something that is going to last long term? And when you move teeth, you're going to move them out of the bony housing most of the time. It's rare that when I see a patient that comes in for recession that's had orthodontic therapy, that the tooth is in the middle of the bony housing. It's out of it because they're just trying to put in the position where the forces of occlusion along the long axis of the tooth, and it looks good. But that doesn't necessarily mean the gum tissue is going to be where it wants to be or the bone is. So just because you got a rotated tooth doesn't mean it needs to come out. Again, I always point out there's some news broadcasters with diastemas in their teeth. I won't name names, but that's his brand. That's the way he looks like. Again, if you're comfortable with it, and then somebody says, "Oh, by the way, you ought to put veneers on those teeth, or you ought to, get these teeth straight." If that's not something that you went in to have done, get a second opinion.
One of the things that I always appreciate about you and the Gum Guru podcast is that, it's as much as you are helping out your patients, it's also about informing them and making sure that they have the knowledge and the tools necessary to keep their health in good shape. And it just seems like, it's one thing to get some whatever work done that you're interested in, but it's also another thing to know how it's maintained and how you can prevent from having to need to replace it sooner rather than later, and being equipped with those tools. And that's something that I always appreciate that you are passionate about.
Yeah, definitely. In our practice, we're here to serve, not be served. We want patients to come in and address their issues. The house may be burning up, but they got one thing right there. We'll address it, but we'll also help them out to understand what's going on with their, not only just oral health, but how it affects systemic health too, psychologically, how they feel. I've had patients come in and we just do one little thing and they're in tears because they're happy the way things look, and it didn't take that much of an effort.
Yeah, that's got to be a rewarding feeling. Any other myths that you would like to address or have busted on the show today?
Well, we talked about ab fracture. Oh, maybe like oral devices that you use. Like, I don't want the water pick people to get mad at me, but I mean, I have patients come in and say, I got a water pick. And you know, again, I believe in the KISS principle. Keep it simple. If you have manual dexterity issues, you've got nooks and crannies that are difficult to get to, fine. Water pick's great, but don't let it lull you into a sense of well-being. You know, why are they recommending a water pick? You know, find out why. But if you can use your hands, you're better off. Automatic brushes, Sonicares, they're great. Oral-B's, they're fine. My elderly patients that are debilitated for whatever reason, have arthritis, it's a good adjunct. But if you're young and healthy, and you know, we're all gadget-oriented, but they also are expensive and they break down. Keep it simple.
Yeah, I like it. I like it. What about our action step for today?
It's your gut. If it doesn't feel right to you, and you think, yeah, I don't know, I didn't go in with this issue, and they're telling me I need all this work. It could be they do. Get a second opinion.
Yeah, getting a second opinion. There's no harm in doing it. Can protect your health and also protect your wallet. Well, that's going to do it for us today. On behalf of Dr. Macon Singletary, I'm Jason Kong. Thank you so much for listening to this episode of The Gum Guru.
If you would like to know more about ways to make sure your smile is healthy, or more information on any of the treatments in today's discussion, check out their website at northraleighperio.com. If you have other questions you'd like to have answered on the Gum Guru podcast, send them to contact@northraleighperio.com.